A good day to everyone watching this video. Not a day has passed where hospitals aren't busy. Patients always come and go. Doctors, nurses, and all health workers must always be careful to avoid patients' infections or the transmission of contagious diseases. This is where the standard precaution and transmission-based precaution come in. So what are the difference between the two? The standard precautions are the work practices required to achieve a basic level of infection prevention and control. Transmission-based precautions, on the other hand, are used when standard precautions alone are not sufficient to prevent the spread of an infectious agent. Standard precautions are the minimum infection prevention and control practices that must be used at all times for all patients and in all situations, while transmission-based precautions are based upon the mode of transmission of the infectious agent. So these two are used for infection prevention and control risk management and are also approaches that minimize or prevent the transmission of infection. So let's first tackle about the standard precautions. All people potentially harbor infectious microorganisms. As such, it must be assumed that all blood and body fluids or substances are potentially infectious. Standard precautions are the work practices required to achieve a basic level of infection prevention and control. So the use of standard precautions aims to minimize and, where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. So standard precautions apply to all patients regardless of their diagnosis or presumed infection status. Standard precautions must be used in the handling of blood, including dried blood, all other body fluids or substances except sweat, regardless of whether they contain visible blood, non-contact skin, and the mucous membrane. So, standard precautions have practices to follow. The first one is hand hygiene before and after all patient contact. Hand hygiene is considered one of the most important infection control measures for reducing the spread of infection. Hand hygiene is a general term that refers to any action of hand cleansing, such as hand washing or hand rubbing. As you can see in the picture, the one on the left is hand washing using soap, and hand rubbing, wherein you can use any hand sanitizer or alcohol. Microorganisms are either present on hands most of the time or acquired during healthcare activities. The aim of hand hygiene is to reduce the number of microorganisms on your hands to reduce the risk of infection transmission. Next one is the use of personal protective equipment, or also known as the PPE. It could also include, as you can see in the picture on the screen, gloves, impermeable gowns, plastic aprons, face shields, masks, and even eye protection. So the PPE protects the healthcare worker from exposure to blood and body fluids or substances. Okay, next one. The safe use and disposal of sharps. So safe handling of needles and other sharp devices are components of standard precautions that are implemented to prevent healthcare worker exposure to blood-borne pathogens. The safety devices on needles and other sharps should be activated immediately after use. Remember, used needles should be discarded immediately after use and not recapped, bent, cut, removed from the syringe or tube holder, or otherwise manipulated. It is not allowed. Okay, the fourth one, the respiratory hygiene or cough etiquette. So measures to avoid spread of respiratory secretions should be promoted to help prevent respiratory disease transmission. These etiquettes includes simply covering the nose and mouth with a tissue when coughing or sneezing, or use the crook of the elbow to contain respiratory droplets. Don't use your hands when you are sneezing. It still spreads the infectious diseases because you always use your hands. Remember to use the crook of the elbow when sneezing or coughing. You can also use tissues to contain respiratory secretions and discarding in the nearest waste receptacle after use, or by performing hand hygiene immediately after contact with respiratory secretions and contaminated objects or materials. So follow the four pictures on the screen. That is the basic cough etiquette or the respiratory hygiene. Okay, fifth, the safe injection practices. Unsafe injection practices put patients and healthcare providers at risk of infectious and non-infectious adverse events and have been associated with a wide variety of procedures and settings. As defined by the World Health Organization or WHO, a safe injection does not harm the recipient, does not expose the provider to any avoidable risks, and does not result in waste that is dangerous for the community. These practices include the use of a new needle and syringe every time a medication vial or IV bag is accessed, use of a new needle and syringe with each injection of a client, using medication vials for one client only whenever possible, and safe injection practices backup. This is very important, so you must all remember these. The sixth one is the sterile instruments and devices. The delivery of sterile products for use in patient care depends not only on the effectiveness of the sterilization process, but also on the unit design, decontamination, disassembling and packaging of the device, loading the sterilizer, monitoring, sterilant quality and quantity, and the appropriateness of the cycle for the load contents and other aspects of device reprocessing. Furthermore, care must be consistent from an infection prevention standpoint in all patient care settings, such as hospital and outpatient facilities. So, as you can see on the screen, on the left side, these are examples of equipments or instruments that are needed to be sterilized, and on the right side you can see the process of sterilization of the instruments and some devices. And lastly, for the seventh one, environmental surfaces must be disinfected. So client care areas, common waiting areas, and other areas where clients may have potentially contaminated surfaces or objects that are frequently touched by staffs and clients should be cleaned routinely with disinfectants, following the instructions for amount dilution and contact time. So examples of these surfaces or objects that are frequently touched are the doorknobs, the sinks, toilets, other surfaces, and items in close proximity to clients. So, housekeeping surfaces such as floors and walls do not need to be disinfected unless visibly soiled with blood or body fluids. They may be routinely cleaned with a detergent only or a detergent disinfectant product. So, those are for the standard precautions. Let's now move on to the transmission based precaution. So, transmission based precautions are the second tier of basic infection control and are to be used in addition to standard precautions for patients who may be infected or colonized with certain infectious agents, for which additional precautions are needed to prevent infection transmission. So, there are three routes of transmission. First is the airborne transmission, second is the droplet transmission, and third is the contact transmission. So, for the first one, airborne precautions. These are used for patients known or suspected to be infected with pathogens transmitted by the airborne route. Example of these are tuberculosis, measles, chickenpox, and the like. And the airborne precautions include six. First is the source control. You must put a mask on the patient. Second, ensure appropriate patient placement in an airborne infection isolation room, like what is happening nowadays because of the COVID-19 virus. There must be isolation rooms so that the virus will not spread, or it will be a prevention for the virus to spread. Third, restrict susceptible healthcare personnel from entering the room of patients known or suspected to have contagious diseases. Fourth is the use of the PPE appropriately. Fifth, limit transport and movement of patients outside of the room to medically necessary purposes. And sixth is immunize susceptible persons as soon as possible following unprotected contact with vaccine preventable infections. So that's for the airborne precautions. Let's move on to the droplet precautions. So droplet precautions are used for patients known or suspected to be infected with pathogens transmitted by respiratory droplets that are generated by a patient who is coughing, sneezing, or talking. So, like the airborne precautions, it's a little bit similar to it because it also includes putting a mask on the patient. That's the first step. And the second one is ensure appropriate patient placement in a single room if possible. It also includes the use of personal protective equipment appropriately and limiting of the transport and movement of patients outside of the room. So those four are very important for the droplet precautions. And the last one is the contact precautions. These are used for patients with known or suspected infections that represent an increased risk for contact transmission. So the contact precautions include: first is the ensuring of appropriate patient placement in a single patient space or room if available in acute care hospitals. The second is the use of the PPE appropriately, including the gloves and the gown. You must never forget about those two. Third, limit transport and movement of patients outside of the room to medically necessary purposes. The fourth one is the use of disposable or dedicated patient care equipment. And the fifth is prioritize cleaning and disinfection of the rooms of patients on contact precautions, uh, ensuring rooms are frequently cleaned and disinfected, focusing on frequently touched surfaces and equipment in the immediate vicinity of the patient. So, both standards and transmission based precautions are vital in a healthcare facility, especially nowadays with the ongoing pandemic. So, to prevent more victims, these precautionary steps must be done. So, that's all for today's video. Thank you for watching.